Right, welcome back everybody. Now, sleep is the foundation of our overall health and well-being, yet it's often overlooked in our busy lives. Let's not underestimate its importance. It's not just a time for our bodies to rest, it's a period of profound restoration and rejuvenation, impacting both our physical and mental health. Studies show that sleep loss can impact different parts of the immune system, leading to a higher risk of developing disorders, reduced immune function, and a higher risk for infection. On Heatlh Matters this morning, we unpack sleep disorders. And joining us in studio, we have got neurologist and sleep specialist, Dr. Boniface Kapseh Cheyip, as well as founder and medical director of SkinRenewal, Dr. Maureen Allem, who will speak on some of the remedies available for people who suffer from sleep disorders and, of course, the repercussions of not getting enough sleep. So good to have both of you here in studio with us. Welcome.
Thank you very much.
So, I mean, let's talk about, I suppose, start with the basics. And Doctor, let me talk to you. The categories of sleep disorders, you know, what are they and how prevalent, till I try that again, prevalent are sleep disorders amongst people?
Well, on a general basis, you'll meet about 30% of the population with sleep problems.
Yeah.
And depending on who you're talking to, the age, the occupation, you'll find that it's more prevalent in certain populations. In general terms, we categorize them as either too much sleep or less sleep. So I don't know which part of the spectrum you want to belong to. So less sleep, we could just put it generally as the insomnias or difficulties falling asleep or maintaining sleep. Or too much sleep is that hypersomnias and the many different syndromes that go with it.
Yeah.
There are other conditions that impact on our quality of sleep, which we could call parasomnia. So these are events that happen within the duration of sleep that impact on the quality of sleep and could be associated with many other medical conditions. I'm sure we'll unpack this as we go.
We certainly will, but I mean, Dr. Allem, from your perspective, because I mean, hearing, you know, there are a lot of people that do struggle with some kind of sleep disorder. How does that happen? What leads us to having a sleep disorder, whether we're sleeping too much, and I know a lot of that could be associated perhaps with mental health as well and depression and all of those things, but then sleeping too little as well is a big problem.
You know, so very often we're all stressed. I mean, so many of us who isn't stressed, and stress causes inflammation, and then you start getting, you know, you start packing on the weight, all the intra-abdominal fat that affects your chest cavity, and then also you start packing weight on your, you know, around your throat. So very often, you know, patients who come in and I see they've got hypertension or they've got, you know, type 2 diabetes or they're on a sleeping tablet. I always ask them, how do you sleep? That's the first question that I ask.
Yeah.
And very often I can just see it in them that there's a problem. And then I'll say, why are you on the sleeping tablet? No, they can't fall asleep or they keep waking up at night and then, you know, they go to the GP and then they get a sleeping tablet. But I'm always looking for the cause of why, you know, what is happening, what's causing this insomnia. And very often you'll find that it's either sleep apnea, so it's when, you know, when you go into deep sleep, your whole body relaxes, because that's part of deep sleep.
Yeah.
And that's when your immune system kicks in, your memory updates that, and in REM sleep, your hormones balance. So many things happen in deep sleep. But what happens, your whole body relaxes, the tongue falls back and stays back for 10 seconds or more, and your saturations, your oxygen saturations drop. They can go down as low as 70. And then all of a sudden your body wakes you up and then then you breathe again. So either you snort or something happens and, you know...
And it breaks that sleep.
So that breaks that deep sleep cycle, then you've got to start again. So you're not getting adequate deep sleep.
Yeah.
And then very often in the morning when you go into REM sleep, which is so important for memory consolidation, you'll find that once again the whole body relaxes so you don't act out your dreams. And then you also, it actually gets worse, you know, I find, you know, because I've got sleep apnea and I can actually monitor to see when my apneas really start happening, and that's like early hours of the morning. between 2 and 4, it really gets bad.
Yeah.
So you have to ensure that you are getting proper restorative sleep at night, because otherwise you're going to be sleepy all day, you're going to be fatigued, you're going to start, it puts your body in sympathetic activation.
Yeah.
So if you think you're stressed in the day, believe me, you're more stressed at night.
Yeah.
And stress causes massive inflammation, and that affects the endothelial lining of all your arteries, and everything starts going up. So if you think you're sleeping, there's a silent killer in your room if you have sleep apnea.
You know, it's actually
It is
unbelievable.
a serious problem, and people just,
don't know
they
it.
switch off. They
Yeah.
bury their heads.
You don't even know you've got it. But, I mean, in terms of sleep apnea, doctor, do you treat a lot of people for this? I mean, are people undiagnosed? Do they even know they've got sleep apnea? Unless, of course, you have a partner who is watching you and, yeah.
To a large extent, many people know they have the symptoms, they just don't know what to do about it. And the bulk of my patients are brought by their partners, so you're very correct there. And so that's why I think programs like this are very important. So thank you for giving us this opportunity to enlighten our population about the importance of sleep and the consequences thereof. So it's very common, but it can easily be diagnosed in a lab, where the history is usually typical. We've had this stereotype that people who are fat, who are big, are the ones who have sleep apnea. But it's not absolutely true. She's a case in point, and she said that. But it's diagnosed in a sleep lab where we do what we call polysomnogram. And that shows just how many times you go into apneic attacks. And what that means is that periods when you don't breathe. And with the consequence that your blood oxygen level drops to very dangerous levels. Yeah. And that is where the metabolic catastrophe happens while you sleep. Amazing. Your blood pressure shoots up, your heart is racing, and many times people have heart attacks and stuff and strokes, and you don't know why. And it could just be because of sleep problems.
Isn't that crazy? I mean, it's a great worry, because these are things that are happening and you may not even know.
Correct.
And that's the reality of the dangers of something like this. I want to sort of make it even a little bit simpler. So sleep apnea is one that we need to look for. But if I can even take it back a bit, how many hours should we be sleeping? Because what
Between
is
7 to 8 hours a day.
And that is non-negotiable.
Well, look, again,
but it also
that
depends.
is general population.
General population. 7 to 8 hours.
I always like to individualize my patients.
Yeah.
The people who have genetic predispositions to sleepless, but not everybody. It's important to know that the bulk of the population will be exactly where she's talking about, the bigger percentile. But there are people who will need less sleep to be fine. So I like to individualize on each patient. There are some people who sleeping, 7 hours might not be enough, and you need to find out why. What it is. So how do you know? I mean, just in terms of perhaps from your experience, how do you know if you're not getting enough sleep? What are the things that you look for?
Okay, you wake up exhausted, like you haven't slept at all.
Absolutely.
You could wake up with a headache.
Yeah.
So there's fatigue. Like some people actually fall asleep at work. When they sit quietly and they're not all go. If you're just sitting quietly watching TV and you fall asleep, that's a trigger, and that's a red flag to say there's something wrong. Or if you're sitting at work and you fall asleep because you are so exhausted because you haven't had that restorative sleep during the night. So you might be sleeping for 10 hours, but who knows how much actual restorative sleep you're getting.
Yeah.
Because that is what counts, the restorative sleep. So it's the deep sleep and the REM sleep that really count when you in sleeping.
And you feel it. I mean, your body will tell you. I mean, I remember when I was going through a phase of not sleeping enough. I mean, one of the first things that came was anxiety. That it would just
you cannot believe how it causes anxiety.
Huge.
I actually went to a sleep congress about 10 years ago.
Yeah.
And I met one of my colleagues who had now become a psychiatrist. I hadn't seen him for 40 years. I'm giving my age away. But I said to him, "What are you doing here?" He said, "You know what, I work in the provincial hospital it was in Mpumalanga." And he said, you have no idea how many of my patients with depression and anxiety.
That's it.
actually have got sleep disorders like sleep apnea. So he came up to the conference and he was working on a mandibular device, because very often people don't even have electricity to put a CPAP on.
Yeah.
I mean, and with load shedding, it's a problem. So he was working on a mandibular device to actually pull the lower jaw forward to open that space at the back of the thing.
Incredible.
So neurotic people, people with depression, and apparently with depression it works both ways. Makes you depressed, and the fact that you got sleep apnea, so it works. It's a two-way thing when it comes to depression.
A vicious cycle, in other
Yeah,
words,
so
just describing it in
just-
those simple terms. You mentioned a bit earlier sleeping tablets. Doc, I want to bring you into this. So, obviously there are a lot of people that take sleeping tablets or sleeping aids of some sort.
Correct.
Let's talk about the dangers of taking them and perhaps the benefits of it. I mean, if you need to, because the dangers of not sleeping, do they outweigh the dangers of taking them?
Yeah, the bulk of patients who will be referred to us as sleep clinicians would have been on maybe 1, 2, or 3 sleep tablets. I mean, I've seen people who have been on 4 and on very high doses at night.
To try and
you
just get
really
some
don't
rest.
know, and they've come to you because they still can't sleep.
So there's always an underlying cause is what I'm gathering here. And
Exactly.
you need to know what
Exactly.
that cause is.
Exactly. So it's important, the first thing I do, and one of the things I like to debunk here is a myth that everybody needs to have a machine. The first thing we do is take a good history. Find out about you, your lifestyle. Why do you take it? What are the triggers? What are the predisposing factors? And we look at the medication, and many of them at times they are they're interacting. There's so many reasons why the medications are not working. Most times it's your lifestyle that's contributing to it. And those are things we need to address. No matter how much medications you take, if your lifestyle is averse to good sleep, you would have problems with sleep. So talking about sleep, medications, it is the prerogative of the sleep clinician to decide which medications. And I tell my patients, you don't need to feel guilty for taking it when you really need it.
Yeah.
Because my job is to get you to sleep and to sleep effectively. Because if you don't sleep, you have a bad day. So we need to get you to the right medication with the least possible side effects. That's my mantra. Least dose, best side effects, best effect, clinical effect on you.
To get those
The right balance, in other words.
I want to, we're running very quickly into time that we've got to get out, but I want natural methods. If you do struggle with sleep and you're lying there in the dark of night and you're like, please help me, people tell you to count sheep, and that cycle we spoke about gets worse and worse because then you become paranoid going to bed thinking you're never going to sleep. How do you help yourself?
There's a whole thing called CBTI, Cognitive Behavioral Therapy for Insomnia, and you can download the app. I think it was made by the Veteran Society in America.
Yeah.
So you download that app, and it actually teaches you. It's got meditations, and it tells you, so it's actually, if you can get someone to help you with it, but if not, you can even train yourself, and there's no excuse these days, Leanne, for ignorance. There's Google out there, and there's artificial AI that you can go on and say, just put in there, how do I help myself with CBT, small I, insomnia.
Yeah.
And that really helps because it gives you meditation exercises to calm down. And then they say that you only go to bed when it's a whole program where you only go to sleep when you're actually feeling tired.
Amazing.
So go look up the CBTI, and there's also an app out there called Firefly, which is free. And you can put it, you have to have Android or Apple, you can put it on your pillow, and it actually monitors you the whole night to see exactly your breathing patterns, and it can, so it lowers the barrier for people knowing, do I have sleep apnea or not?
Amazing.
Okay, so go and get that, and you can do it every night, and then you can say,
and
okay,
you kind of monitor how it works.
Yeah, so you can do your own screening.
There's the most, I'm going to lead a lot of people to, I'm wrapping this up, but there's an amazing article I'm going to send to both of you. It just came out this morning from The Economist, coincidentally, where there was a massive study done of about 220,000 people around the world at the same time to not only see the hours they sleep, but that deep sleep that you speak
with all
about.
those wearables,
Yes,
like the Oura Ring.
And they publish the results. You've got to see that.
It's incredible.
It is amazing. South Africa, we top 14.
But just wake up, when it comes
Wake
to
up and
sleep
sleep.
apnea. Yeah.
Wake up and sleep.
Wake
That's what
up
you
and
gotta
be
do.
aware of it. That's all I'm saying to you guys out there. And don't
you.
neglect it, because really
It's
a
bad.
killer.
It is.
And you know, if you're snoring, it is no joke. It is a killer.
There is
it's a
something
silent killer.
underlying. Well, there you go. Neurologist, thank you very much, Dr. Kapseh. And of course, Medical Director and founder of SkinRenewal, Dr. Allem, also talking to us here. And I can already see comments coming and saying you found it exceptionally insightful and a very important topic.